Hi, I'm Matt Duncan. I'm the clerkship director for the third year course in psychiatry and a Dartmouth Medical School graduate in 2001. I've been asked to give a little bit of advice on psychiatry and the clerkship, and then perhaps choices going after medical school and into residency. The thing that I hear most from med students who finish their psychiatry clerkship rotation is that they're surprised how much they enjoyed it. And I think one of the biggest points of advice I would give people coming into psychiatry is come in with an open mind. I think very few people go to medical school thinking about doing psychiatry. I know I didn't, but it was on the rotation where that all changed. And I think it's one of the few clerkships where, as a medical student, you can really get involved deeply in the practice of psychiatry within the time of the clerkship, because it requires less technical skills, so to speak, than some of the other clerkships where you may need to learn surgical procedures, etc., etc. Now, to answer a few of the questions here from students, what electives are best to prepare students for this specialty and to bolster their residency application? I think in psychiatry, if people do develop an interest, there's often a question of, do I do a sub-I in psychiatry or a different field? And I think it depends on a person's particular interest and how they performed on the clerkship. If they got an honors grade in their clerkship, then I usually recommend that they do a sub-I in something else. And usually I recommend internal medicine, because even as part of residency, that's a big part of what you'll be doing. I think your skills need to be strong there. If you didn't perform as well in the clerkship or just have a very specific area of interest in psychiatry, then it makes a lot of sense to do a sub-I, particularly if you have a particular residency or program in mind, then doing a sub-internship at that facility, both to check them out and for them to get to know you, makes a lot of sense. Another question is, does it make a difference if a given student is very strong versus average or somewhat weak? I think in psychiatry there's a good opportunity for most students to perform very strongly. Students come to medical school with a strong desire to interact with patients and to just be helpful to people. And those two attributes and skills are easy to display in psychiatry. So I think if someone is attentive, has some interest, and a little bit eager, they can actually perform very well in psychiatry. How important are international rotations if interested in global health? That's an interesting one in psychiatry. There are lots of opportunities for global health service in psychiatry. They're a little harder to find than some of the other specialties. I think that a student does not need to do those in medical school if they want to pursue that later. What is your advice on the timeline if a student cannot decide between two residencies? This has actually been an issue lately of students, trying to decide between family medicine, internal medicine, and psychiatry because of some of the overlaps. It is a decision that probably needs to be made by the end of December of the graduating year. It's hard to try to make interviews to lots of different programs. And it's well known that people who decide to go into psychiatry do tend to make the decision a little late. They find that it wasn't on their mind to begin with. They rule out a lot of other things that have aspects that they don't like, and they enjoy the patient-centered focus, so it can be a late decision. So sometimes you do get squeezed in that late fall, winter time to make that decision. In a highly competitive field, what advice do you have? Psychiatry is not a highly competitive field, but what it does need is some really good doctors. And Dartmouth medical students, I think by virtue of who comes here, the selection process, and the way that medicine is taught at Dartmouth really sets people up very nicely to be excellent psychiatrists. So it doesn't have the same competition as specialties and surgical residencies, but it is in desperate need of very good physicians. Your third year to fourth year transition thoughts. I think third year is a very difficult year for students. You're asked to be a different doctor in a different hospital with a different team and a different set of expectations every 2 months. And that is no small task. And all along the way, people are evaluating you at every twist and turn and commenting on your personality and your professional behavior and your skills and your knowledge. So third year is a uniquely pressurized environment. And I think fourth year is a nice opportunity to take some of that pressure off and to explore more individual interests, and particular things that may be somewhat outside of your area of specialty or residency training, if you have that liberty, because you will learn what you need to learn in residency. And so one of the last questions is here, how much do you need to know graduating from medical school? And the reality is that you know more than you realize you know. That your background of knowledge has grown so vastly in ways that you probably don't even recognize. And that you're well trained when you leave Dartmouth Medical School, and that when you're in a residency program, they will teach you what you need to know to be a good doctor in that area. So I wouldn't worry too much about that. The fact that you're able to graduate from this school, you will be well prepared.